Hi, I'm Dr. Sujit Anjas. I represent the Department of Urology and Renal Transplant, Government Medical College, Kozhikode, Kerala, India. I present our study on bladder diary, a vital tool to compare circadian oscillations in diuresis pattern in men with nocturnal polyuria syndrome and secondary nocturnal polyuria. I have no relevant financial disclosures. Nocturia, the most bothersome lower urinary tract symptom, is associated with many underlying causes and contributing factors. Among them, nocturnal polyuria is a frequent contributor and is often overlooked. It is therefore essential to accurately diagnose the types of nocturia and the associated medical conditions for better treatment outcomes. This original study compares the pattern of diuresis at different circadian phases in men with nocturnal polyuria syndrome and secondary nocturnal polyuria. Here, retrospective analysis of the 3 days bladder diary in men with nocturia and nocturnal polyuria were studied. Patients with nocturnal polyuria and chronic kidney disease, congestive cardiac failure, obstructive sleep apnea, uncontrolled diabetes mellitus, peripheral edema of other causes were classified as secondary nocturnal polyuria. Patients without these conditions and not on loop diuretics were classified as nocturnal polyuria syndrome patients. The volume and timing of nocturnal and diurnal voids from the bladder diary were used to derive the initial sleep diuresis rate, that is the urine production rate from the sleep onset to first nocturnal awakening, middle sleep diuresis rate, that is the urine production rate from the first nocturnal to the last nocturnal awakening, terminal sleep diuresis rate, that is the urine production rate from the last nocturnal awakening to the first morning void, and diurnal diuresis rate, that is the daytime urine production, and all these diuresis rates were expressed in ml per hour. Matching was done for evening fluid intake and evening caffeine intake in men with nocturnal polyuria syndrome and secondary nocturnal polyuria. The odds of having a peak initial sleep diuresis rate, that is, initial sleep diuresis rate more than middle and terminal sleep diuresis rate, was compared between patients with nocturnal polyuria syndrome and secondary nocturnal polyuria using both univariate and multivariate logistic regression. Difference in mid-sleep diuresis rate and terminal sleep diuresis rate in both patient categories were analyzed using Wilcoxon signed rank test. The study was completed in 83 patients, with 48 patients having nocturnal polyuria syndrome and 35 patients having secondary nocturnal polyuria, with 18 patients having chronic kidney disease, 7 patients with congestive cardiac failure, 3 patients with obstructive sleep apnea, 4 patients with uncontrolled diabetes mellitus, and 5 patients with unevaluated pedal edema. There was no statistically significant difference in the mean age, body mass index, and daily fractions of evening fluid intake between the two study groups. From the table, we can see that men with nocturnal polyuria syndrome and secondary nocturnal polyuria differ significantly in their diuresis pattern. Men with nocturnal polyuria syndrome have a peak diuresis rate in their initial sleep, which gradually decreases towards the terminal sleep period. Men with secondary nocturnal polyuria have an F phase in the diuresis rate in the initial sleep period, which surges as the sleep progresses. Patients with nocturnal polyuria syndrome had 5.3 times higher odds of having peak initial sleep diuresis rate when compared with patients having secondary nocturnal polyuria. Patients with nocturnal polyuria syndrome had a statistically significant higher mid-sleep diuresis rate than terminal sleep diuresis rate. In patients with secondary nocturnal polyuria, there was no statistically significant difference between the mid-sleep and terminal sleep diuresis rates. The full multivariate logistic regression analysis, initial peak sleep diuresis rate and hypertension remained as statistically significant predictors of nocturnal polyuria syndrome. Exploratory analysis of the pattern of diuresis in patients with chronic kidney disease, congestive cardiac failure, obstructive sleep apnea, and pedal edema of unevaluated causes demonstrated that the terminal sleep diuresis rate was greater than the initial sleep diuresis rate. But in patients with uncontrolled diabetes mellitus, they showed a pattern very similar to that of patients with nocturnal polyuria syndrome, with the initial surge in the diuresis rate. This difference in pattern of diuresis rate can be attributed to the different pathophysiological mechanisms involved in each category. Nocturnal polyuria of cardiogenic and renal etiologies are associated with sodium predominant diuresis, and nocturnal polyuria syndrome is associated with free water predominant diuresis. Patients with nocturnal polyuria secondary to uncontrolled diabetes mellitus showed a pattern similar to nocturnal polyuria syndrome. This can be explained by the combined effect of diabetes mellitus on the neurophysiology of lower urinary tract in addition to solute predominant diuresis. So from our study, we could conclude that in various etiologies of nocturnal polyuria, intervention should vary as per the different underlying mechanisms. Bladder diary is a simple, effective, and vital tool in the categorization of nocturnal polyuria patients and in the formulation of individualized treatment plans. Better understanding of the oscillations in the nocturnal diuresis rate in nocturnal polyuria patients can improve treatment outcomes by optimizing timing and half-life of antidiuretic medications. Thank you for your kind listening. We are happy to clear your queries through the comment section below.